Hi, everybody. Welcome to GWU Center for Integrative Medicine Zoomcast. I'm Dr. Kogan, Medical Director, Associate Professor of Medicine, Geriatrics, Palliative Care at GW. Wonderful to have Jennifer back. We're going to talk about tinnitus today, but before we do that, Jennifer, you had news, so maybe you'll share the news with our listeners first, and then we'll talk about this difficult topic of ringing.
Sure. So the news is that I became the executive director of the Institute for the Study of Integrative Healthcare at Utica University. And I'm still associate professor adjunct at GWU Integrative Medicine programs. And I'm also still a clinician at GWU CIM. So those are great things.
Instead of
Three
one hat,
hats.
now there's three hats.
I actually had three before when I was vice director.
Okay. All right, good.
So it's just slightly different hats, but yeah. So, and Dr. Kogan is going to chair a clinical innovations committee. So that is very, very exciting. We have lots of plans, and just really happy to be here again, talking about things that matter to patients.
And for those of you who wonder what's up with the background, both of us actually, our families live in Tacoma Park, which we love our little town, and we're blessed with this being in a city, but having this wonderful backyards because it's quite common for our town to value the nature and being outdoors. So that's we decided with that in mind to do this outside. So difficult topic. It's I've seen a lot of patients over the years with ringing in the ears, ranging from a little bit to very severe, and basically to the point where some people are so affected that they're really looking for any help of any kind. And what's interesting is that if you kind of think about this, there's really no formal treatment. The treatments that are often offered, they're really not to treat an actual tinnitus. They're really to cover up. So my dogs are, of course, becoming loud. Sorry about that. Come over here, you guys, come. They get excited. Anyway, so and the typical treatments would be like a basically muffling sound or an attempt to try to use other noises to mask out the tinnitus, which it's at the best they're just supportive treatments, but they're not really have any chances of curing. Things that I've seen go well were basically all based in a toxic element where you can effectively detoxify. It's not with every patient, but it's with a lot of patients. But I know that with your Ayurvedic approach, you can shift patients quite profoundly and in a little different ways. So why won't we talk a little bit about that?
Okay. So let me say about tinnitus that it is most commonly a vata aggravation type of symptom. Primary qualities associated with vata are cold, dry, light, and mobile. So those are the qualities that become aggravated in the body-mind that can result in something like tinnitus. Tinnitus is almost always a symptom that comes with a complex package of other symptoms, but because of its effect on quality of life for the patient, it often rises to the top of the list for treatment for patients. Some of what we do all of what we do in Ayurvedic medicine is root cause oriented. So we are going to treat that vata aggravation. And
let's back up for a second. I mean,
yes.
Just for the sake of patients who kind of don't understand this language at all. Like when you first start talking to someone, presumably they know some basics what Ayurveda is, but they don't really understand the points between different types and like how would you characterize someone who presents with this vata imbalance?
So anyone can manifest a vata imbalance, but typically in Ayurveda we go out of balance in the direction of our primary dosha. So a lot of people with a vata constitution may be more prone to something like tinnitus when there's depletion present or the immune system is disrupted. But honestly, any of the constitutions can develop an autoimmune type of condition or syndrome.
Mhm.
Even, and what Ayurveda does is we don't need the label of what type of autoimmune syndrome the person has. We understand what it looks like in terms of symptom complexes, and we just treat that way. So it's not, in that sense, we can treat a subclinical autoimmune syndrome in the sense that it doesn't have a Western biomedical diagnosis.
So I kind of like this whole principle. Like the way functional medicine thinks is this: like we trying to find a bunch of drivers and treat them. The problem with that approach is quite often the drivers are not easy to find. They're not on the surface. And you think you found one, you treat it, but the patient's not getting better. And often it means there's a whole bunch of other ones that you haven't touched. So
Mm-hmm.
I think with
Mm-hmm.
the way I kind of sense what you're trying to say, and I think it's probably the same with other systems, like maybe with homeopathy and with traditional Chinese medicine, is that you're not necessarily caring particularly, okay, there's one driver. You care about the whole energetic
Mm-hmm.
footprint and the whole body operations, and you're addressing it on the whole, diagnosing it from perspective of a whole system shift, which is then
Yes.
you can't really miss anything in there, so to speak.
Exactly. And we don't, in essence, care what is the thing that works. We're relying on the cumulative effect and the synergy across therapies. So
Mhm.
Ayurveda is a system of medicine that understands all conditions as multivariate in their nature
Mhm.
and all therapies as multimodal in their application. And that's very important for understanding kind of the whole systems orientation of many of the holistic paradigms, including integrative biomedicine has that understanding. So, and that's very important for tinnitus as well, because there will be many things going on in the system. And tinnitus is just one of a number of manifestations. So, so
I
we
think
know
that's
that, yeah.
I think that's also a challenge, and not just for practitioners. It's a challenge for public. I mean, I think the patient's always trying to say, okay, what is the easiest route to get somewhere, right? And then functional medicine often fits very well there because I could explain a particular point very well. I could say, look, you got mercury toxicity. That's how it's linked to the tinnitus. And okay, that's easy. And a lot of people will grasp this. Like if I were to present right now a case of cured tinnitus by detoxing mercury, which I have case like this at some point, I'll
Mm-hmm.
present it. But it's like for each case like this, there are dozens and dozens of people who do not going to have it and who are not going to improve. But you're bypassing all of this noise in one kind of whoop, and you're there. The
Mm-hmm.
problem is then not just grasping people's attention, but grasping attention for quite a while, because the process of working through it takes how long? Like, what would it take for you to kind of get someone from point A to point B here?
Right. I mean, it depends how far along the path of depletion and kind of immune disruption they are. If they're early in the path, it could be, maybe 6 months. If they're farther along that path and they've really been struggling with, the chronic symptoms of autoimmune disruption and depletion, then, it could be a couple of years to get them back to where they were, let's say back
Couple of
to
years.
optimal.
A
Yeah.
couple of
And
years. Well, I mean,
yeah, and
but that's the
I tell
point.
that to patients. I tell them, you don't want to hear this, but this is, especially with people with an autoimmune condition, the body has and the mind, there's memory, and it's like a groove on an old school record or something, that once the body is in a habit, it's to really bypass that habit and remove the memory is very important. So with autoimmune patients, I often tell them, you've fallen into a hole. So what we have to do is not just extract you from the hole, that maybe takes us 6 months, but then at that point, you'll be sitting on the edge of the hole with your legs dangling over the hole. You're
I
not
love that.
safe. In a
Love
year,
the
you might be
comparison.
standing up with your back to the
Right.
hole, but you could be pushed over at any moment. So in 2 years' time, you've walked away from the hole and you're in an entirely different, location, back to a place where you have a lot of resilience and robustness. You can tolerate insults from the environment, from, bad habits or stress. Your body can now tolerate those things and you don't have to worry about falling back in the hole. And when you explain it in that way to patients, I mean, a lot of them have a lot of anxiety about, sensing themselves as fragile, their health being somewhat fragile, and they sort of can invest in the idea of, wow, I don't want to be anywhere near this hole. Let me get all the way out of here, even if it takes me 2 years.
I mean, I think the problem is on top of all this is a process itself. And I'm going to speak a little bit about just what I've been observing is, that when you have to have someone's commitment and it's longitudinal, not only are they paying for each visit, but they're also told to do multiple things. The problem is everybody's used to the system of, okay, either I'm going to get quickly better or I'm going to have insurance take care of everything for a while. And, and that's really one of the main issues. I think long-term goal could be, which is what we're trying to do now, which we would take kind of get pre-approval for a whole process. So like right now we have a long COVID patient from the Peace Corps where we got pre-approved for the entire care.
That's great.
Patient. So
that's a great model.
I think, right. I think the part of the issue is we have to switch the model where the patient feels that they're supported for a while. Otherwise, it's just it's culturally a little difficult for a lot of patients.
Right. In Western society, we like the quick fix, right? But the quick fix is not sustainable. The quick fix, has a very short impact typically. And Ayurvedic care, though it may take a little longer, it's gradual. But right. Things that are gradual, it's just like weight loss, if you want to use another metaphor. Things that are gradual have sustainability over time. Right. And it's what, we refer to in research as durability of effect, right? And we know that the effect that was achieved lasts.
Right, right. And the tinnitus is a great example because it's a long-term neurologic problem that recovery, there's no way of recovering overnight. Like it's not, you can pull a tooth and infection goes away. Nope. It's a long-term shift, which takes months anyway, no matter what you do. And and with that, it's easy to lose the patient because they feel like, oh, I'm not doing any better. Like, why am I wasting time and efforts here? But the reality is they are doing better. Just can't really see it over.
Yeah. And typically in Ayurveda, we do see patients will experience benefit within a month, typically. Now, are they getting resolution of tinnitus within a month? Probably not. Maybe within 3 months, maybe, it depends how long it's been there. But they will definitely notice benefit. And then that's when you get, real buy-in from the patient. And sometimes they'll come for one condition, but an associated condition will be the first thing to resolve. And they'll notice that, they'll notice their energy is better. They'll notice that they can sleep through the night. They'll notice that, their emotional resilience is improved. So because Vata dosha by nature is very unstable. And it is something that changes quickly, but is hard to stabilize. And that's why tinnitus, as a Vata-oriented condition, is also hard to get complete recovery without a comprehensive approach. So what happens in the inner ear is that there is a drying of the tissue, there's a coldness there, there's a lightness in the tissue, and it disrupts both the functionality, but even the structure of the tissue. And so one of the things we do, we're very big on oil in Ayurveda, and we just put a couple fairly warm drops of sesame oil in the ear to lubricate the ear. And you do that, at night, and you sleep with that there. And you do that for a number of months, perhaps. And slowly over time, the tissue inside the ear regains its lubrication. The oil itself is nourishing to the tissue and builds some strength and resilience back in. And it also grounds kind of the energy of the inner ear, because being light by nature, Vata is, that's part of what contributes to its unstable nature. So the oil is by nature heavy, so it will ground the tissue itself. We take, the ear, nose, and throat pathway seriously. So there may be gargling involved there to lubricate and cleanse that part of the tissue, and even maybe full body massage, because as we're saying, when something is aggravated, it's systems wide. So we can do application of oil to the whole body, and eventually it will nourish the tissue of the ear because it's decreasing Vata overall. So there's
you mentioned gargling. So like I often, for different, unrelated to tinnitus, I just want to diverge somewhere for a second because I have a question. So I often recommend patients when they're using neti pot to put a couple of drops of propolis and tea tree oil to when they have an infection. Do you do something like this? Like, would you support, just like you put oil in the ears? Is there anything else, like when you use the cleansing techniques, do you use some, something that people wouldn't necessarily know? I mean, of course, salt is always put there, but
Yeah, I mean, this is where the individualization of treatment comes in. You really have to understand the patient's constitutional nature and their imbalance. And when you apply treatment, you're always treating the aggravated dosha, but you want to simultaneously make sure you're not aggravating any other doshas
right,
or
right, right.
disrupting anything else. So you have to kind of know for yourself, because salt is drying, right?
Uh-huh.
But it's also antiseptic, right? So there's kind of like, you have to weigh those two qualities. How
Mhm.
much is the dry quality aggravated? Can the patient actually tolerate salt in the neti, or do we need to go the oil route? And tea tree is also antiseptic.
Uh-huh.
Tea tree is also drying. A lot of antiseptic things are drying,
Uh-huh.
right?
Uh-huh.
Because it's that wet, cold nature in the body that kind of, or a wet, hot nature, depending, but can really provide an environment where infection can take root and inflammation can take root. So we do want to sort of dry and cool, but since Vata is already dry and cool by nature, we have to be
Ah,
very
interesting.
careful. How
Right.
do we do that in a body that's already dry and cool? We have to do it carefully. And
Uh-huh.
sometimes that's, somewhat responsible for, the extended nature of treatment, is to address primary symptoms without creating other symptoms, right? And, there's a maxim in medicine that, the quicker the treatment, the higher the toll on the body.
That's true.
And I think that, it's very true. When you think about pharmaceuticals and things like that, like the mechanism of action is quite quick, but then the adverse effects oftentimes also quite significant. So in Ayurveda, we go slowly by slowly to make sure not to create additional problems during treatment. So that's, part of what we consider is the individualization of treatment for that person's specific set of symptoms, their constitution, what is the nature of their imbalance, how far along the path of aggravation are they.
What do
And
you
another, go ahead.
what do you think is the most common pattern with tinnitus in Ayurveda? Like, I know there's going to be many different ones, but like,
Yeah. Well, when you see it in a younger person, it's absolutely typically kind of a canary in the coal mine for an autoimmune condition that is brewing underneath the surface,
mm,
because it's very uncommon for the tissue of the inner ear to become dried out and cold and unstable like that. And so that the person is depleted and that there's immune system disruption. So it's a way to see a red flag for autoimmunity without maybe a full-blown syndrome, which is very helpful, honestly. You can treat it all the while restoring immunity. You'd be treating the tinnitus per se, but you're at the same time restoring immunity. The immune principle in Ayurveda is referred to as ojas, and it is considered to be a material substance in the body. And when autoimmunity takes roots, it's become ojas is becoming depleted. You can burn through ojas. You
mm,
can drain it by drying it out because it's an unguent sort of property. It's very moist and thick and dense. It's associated with reproductive fluid and conception. And so when it becomes, sort of deprived of its natural qualities of being heavy, dense, creamy, liquid, smooth, those things, then autoimmunity can develop. And toxicity also informs autoimmunity. Toxicity is a constant drain on the system. It's like a drip, 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 drip. And we have so much toxicity in our environment,
but I
our
mean,
food supply.
In Ayurveda, when you say toxicity, your way of thinking of management is very different from the way that the functional medicine would think. I just want to make sure, because I think it's
Mm-hmm.
actually quite a big point here. I think probably in my experience, at least half of all the patients with chronic tinnitus, if not more, have some toxic load.
Mm-hmm.
And
Mm-hmm.
so in the way the functional medicine would approach it, we would try to support all the detox pathways. Like, we're not necessarily going to say, okay, well, the patient is depleted so much. I think that sometimes, because I'm afraid of being too aggressive at detox and kind of tipping people over who are already
Mm-hmm.
borderline capable of doing any detoxification if you push them too hard.
Mm-hmm.
But general principle is, okay, you just give a binder if it's a metal or something, and then try to pull it out of the system. And that's how the thinking goes, like that, plus support
Mm-hmm.
everything else.
Mm-hmm.
The liver, and make sure your patient's hydrated well, their bowel movements are moving. Like, you're trying
Mm-hmm.
to, but it's still limited. It's still very reductionistic compared to the way you think. So
Mm-hmm.
in your mind, you would apply, a whole approach. Give our listeners a couple of words on that.
Sure. Yeah. So typically, like you said, toxicity is, in kind of a Western kind of even integrative biomedicine context, is that you're forcing the system to detox. You're trying to create a catalyst which will trigger a process that is malfunctioning or shut down in the person. And in Ayurveda, we do want to consider some of the same things. We always ask about frequency and types of bowel movements. We always want to think about hydration, because obviously helps for toxins to move through the GI tract and out. But we have an understanding of metabolism that is quite comprehensive, and it's referred to as Agni. Agni is metabolic fire that exists in the GI tract, but also in all the tissues and organs of the body. And so when our primary metabolic fire in the GI tract is disrupted, it then sort of leaks out into the other tissues and also disrupts their metabolic fire. And we have in Ayurveda a concept of sensory digestion, basically, where the sensory organs can also become overloaded with stimuli and become toxic. And in the world we live in, that's very, very common,
Boy, we
constant
know
screen
some
time.
patients. We know you and I share some patients like that. I'm just thinking
Right,
people. I'm like,
right.
okay.
Constant visual
I know
input,
someone like
constant input to the ears, constant input even to the tactile sense, right? Smells are very strong in the world we live in. There's a lot of chemical input. And so sensory toxicity is in fact very common. And what people don't understand is that detoxing the senses on a regular basis is very important. In the related science of yoga, related to Ayurveda, we have something called pratyahara, which is withdrawal of the senses. And so even something like silence is a treatment for tinnitus, because we're removing the sensory input, allowing the inner ear to have a break, to rest, to try to recover. I mean, I will often tell patients, go sit, lie down in a dark room, put an eye bag,
It's funny
and
you mentioned that, because
yeah.
in the like a deeper, because you and I share some spiritual common lineage here, in Sufism, medical system of Sufism is Ayurveda in part.
Mm-hmm.
And so in there, there is a way of thinking of tinnitus spiritually as an exponentially enhanced message from the divine, because in reality, there is a practices to try to develop the sense of tinnitus, to hear that universal sound.
Mm-hmm.
And so, like, we often forget that some of the main teaching components of our problems are hidden in that path. And if you just pause, and instead of trying to do things, you just stay in silence and you listen to the message that comes from the symptom, sometimes a lot of things can occur. And like you
Mm-hmm.
just mentioned, how avoiding the stimuli and like really going into the silence is the treatment, is it actual treatment in
Mm-hmm.
Ayurveda. And
Mm-hmm.
it's very difficult for standard system to grasp approaches like this. It's hard.
Right. It's hard for them to understand that doing nothing or removing activity, in a sense, is restorative, right? And that's part of what any type of restorative activity is necessary to refuel the immune system and to develop, or reestablish resilience. we're always going to have insults to the body mind, but we have the immune system and the nervous system have to be strong enough to kind of weather them and adapt in a responsive way, right? Rather than reacting in a triggered way that causes symptoms and illness and conditions to develop. So tinnitus is a really interesting example of the ways in which understandings of imbalance in some of these more holistic systems of medicine invoke therapies that they appear quite simple, and they appear almost like, well, why would that work? But it does work. We do have to reduce the stress on the organs of the body at times, including the sensory organs. We have to give them time for rest, and we typically don't do that, and it doesn't occur to people that the sensory organs of the body can become overloaded with stimulus, can become toxic, and need to, be have removal of stimuli. The other way that we detox in Ayurveda, which is very gradual and which can be done even without a symptom, is, the use of spices in foods. I mean, all the carminative spices, which is most spices that people know about, they have a gradual detox effect in the body. They will help to burn undigested foodstuffs in the digestive tract, and they will keep the digestive tract clear. When toxins develop in the digestive tract, it's kind of like this, depending on the nature of the imbalance in the person, it can be a dry caked layer on the intestinal wall, or it can be like a hot, thick blanket of toxins. And so we have to try to move them out.
You're not talking about it purely biologically, because there's also a big energetic footprint, and that's a little harder
to
explain.
It's both. Yeah.
It's often like I get questions about, because there's certain things that are really difficult to prove from biological perspective, like how do you identify certain things that then if the colonoscopy is done, it's not really seen, but it's a lot more sophisticated than that. It's not, certain things are not obvious.
Right. And I mean, I think colonoscopy can detect inflammation, right? Can detect porosity of the intestinal wall. And these are some of the things that happen over time. But also, I mean, even just, an ultrasound of the abdomen or something like that can show, that there's fecal matter that is, basically stuck in the GI tract and is not moving out. And this creates, it's almost like a deprivation of oxygen to the tissue. And so the tissue begins to somewhat, break down a little bit. The functioning becomes compromised. And so in Ayurveda, we do pay a lot of attention to making sure that not just the GI tract, but all the organs, including the sensory organs of the body, have appropriate regimen of detox, and that things are moving through at the appropriate rate. We have our ideas of physiology are a little different.
I think people often don't realize that when particular tissue starts getting strained, that the toxic load is not necessarily that there's a toxin sitting. It's simply that tissue is now way more biologically active. It has to repair itself. While the process of repair occurring, there's an excess of free radicals is formed. Those have to be cleaned up systemically. So like everything in that sense can have some toxic load when you hyper tense or you hyperload the particular tissue or the organ. And that actually adds up. And I mean, that's part of the problem. Like I always think that with Lyme, for example, chronic Lyme, people don't realize how toxic the condition is. Now, of course, there are some toxins from the bacteria itself, but the bigger problem, you have a massive inflammatory responses here and there, and the constant repair produces all this toxic dump of the free radicals. And in what I hear beautifully coming from you're not trying to say, okay, well, you have inflammation in this joint, let's try to treat this joint so there's less inflammation. You're saying, what can I do systemically that I don't have to think about this joint? It's just going to automatically respond because I'm doing the whole system. That's the power and the value of traditional approaches. And I think I'm not trying to critique functional medicine. After all, that's all I do. But that's a part of limitation that I think is good to acknowledge, because a lot of, I think, patients don't really understand that. They don't understand. Sounds like on surface you're going to have a better response with a bit more reductionistic approach, but no.
Right. When you treat root cause and you treat the whole system comprehensively simultaneously, you get that durability of effect, you get resolution, you get walking back of chronic conditions that Western medicine kind of feels like can only be managed or navigated. And in Ayurvedic medicine and Chinese medicine, we know that resolution is possible in many instances. The person can become disease-free from certain chronic conditions, but it does take time. It takes commitment, and it takes, a willingness to change. Sometimes dietary habits, eating inflammatory foods or things. If a person has a vata condition like tinnitus, you have to reduce the dry, light, cold qualities of the foods that they're eating, and you have to increase the oily, dense, liquid, smooth qualities, right? So you might have them have winter squashes, and root vegetables and soups and stews and warm things and warm beverages, and remove ice from any kind of beverages, and not have salads, not have raw vegetables, because if the digestive fire is compromised, which since vata is cold by nature, their digestive fire can tend cold, it's very difficult to digest raw things, right? And so then if vata is also aggravated, it becomes more difficult. And so we do everything simultaneously. We'll attend to diet, lifestyle, daily routine, the person's relationship with self and others. In Ayurveda, everything is bidirectional causality. So say you have tinnitus, it can cause anxiety and fear, which is a vata type emotion. But guess what? Anxiety and fear can also inform tinnitus. So we want to also address the relational aspects, and that includes relationship with self-awareness. What is the root cause of the anxiety? Is it a spiritual anxiety? Is it a person not having a grounded sense of themselves in the world, their place in the world? Do they feel isolated? Isolation is also associated with vata, a sense of aloneness. So treating that from a spiritual perspective, how can we address that sense of isolation? That will improve aggravated vata dosha, and in a circumspect way, but in a way that's very much recognized by Ayurveda, it will also treat the tinnitus.
Great. Well, thank you, Jennifer, so much. So if you have tinnitus, if you feel like it's not treated well, we will definitely open our doors for you. GWU Center for Integrative Medicine, gwcim.com. I'll make sure I'll put the links to Jennifer's bio as well as the clinic's intake process at the bottom of the video in the links. And again, thank you for watching, and stay tuned for more videos on things are important, which things are so interesting in integrative medicine, updates on different things, and how we treat different problems. Thank you, everybody. Thank you, Jennifer.
Thank you. See you soon.